Good evening again, everyone. I'm Lieutenant General Randy George, the commander of 1st Corps in JBLM, and to my right is Command Sergeant Major Shane Pospisil, our Command Sergeant Major. As we move into week 3 of our COVID containment efforts here on JBLM, you may be feeling weary of all of this, limiting your travel, keeping your physical distance, maybe of having kids home all the time, generally of feeling like you've always got COVID on your mind. When I feel like this, it helps me to take a moment to refocus my thoughts. Taking stock of what I am grateful for is a tremendous mood booster. For example, I am discovering new ways to spend extra time with my family. My parents have learned to group FaceTime, and my kids check in more regularly these days. I feel a real sense of gratitude for being able to make these memories during such unprecedented times, and I'm trying to make the best of it. With that said, a lot of our families, friends, and loved ones are not as fortunate as we are. My future son-in-law was recently furloughed because his business has determined that at this time he is not mission essential. He's not getting paid, and that's obviously really stressful for him. It made me stop and think about the fact that all of us in the military can continue to feel somewhat financially secure, and the fact that we can count on our monthly paycheck, which is something millions of Americans right now don't have, amongst other things. While I certainly don't like the limitations these stay-at-home, stay-healthy measures have imposed, I choose to seek out the silver linings in an environment that is filled with uncertainty, and I hope you can join me in doing so. I recognize the challenges and turmoil this situation has thrown us in, and for some of you out there, we know you are facing more challenges and turmoil than others. I encourage you to hunt the good stuff in some part of each of your days. In the meantime, we are going to have a plan for when this starts to settle down so that we can all begin to return to a more predictable routine. So let's talk about what that might look like. First, what everyone wants to know is when will all this end and when we can go back to normal operations. Well, we just don't know, but there is a lot we do know. We know we need to remain resilient. We know the stay-at-home, stay-healthy measures are in place until at least for May. We know all Washington schools will remain remote schooling for the rest of this school year. Your kids will not be going back to brick-and-mortar schools this academic year. We know we've had a few more positive cases of COVID here on JBLM. You can check out the Washington State Department of Health website to track the number of cases across our state. We know that Team Madigan has considered what a spike would look like here on JBLM, and they are prepared should that happen. They have the necessary supplies and medical support. We are trained to do this under combat conditions, so be assured Team Madigan is ready. We know that those in PCS limbo right now are frustrated and concerned. Our helping agencies on JBLM and your chain of command know each of you. We continue to press for timelines so you can make some plans. We want to be sure you are aware of all the resources to help support you and your family during this uncertain time. To that end, we have resources posted on our JBLM website under COVID impacts. Check that out. Let us know what's helping and what you'd like to see more of, and maybe where there's gaps we could fill. We also know that things are not going to magically go right back to normal once the stay-at-home order is lifted. Don't set yourself up for disappointment by thinking that it will simply be a week or two and you won't even know COVID happened. You must expect delays and schedule changes for a couple of months. I need everyone to understand that we cannot predict the date when COVID-19 is considered over. We know that staying active physically and mentally is good for you, and we want all of you to do that. Don't find reasons not to. Find ways to stay fit and ready. Go outside to exercise. Run, ride your bike, jump rope, do the JBLM MWR workout of the day. If you choose to walk, throw a rucksack on your back to challenge yourself. Read books, learn how to play chess, teach your pet a new trick, brush up on your healthy cooking skills. Hashtag your ideas with hashtag JBLM Sound Living and tell us how you're hunting the good stuff. We want to see it. Finally, we know that you must be patient and that your chain of command is the best and fastest way to help you resolve issues you can't resolve on your own. I want to remind you that Sergeant Major Pospisil and I won't be back until next Tuesday, but we are holding targeted town hall meetings every day at 1100. You can see those on the website. They're also posted, there's a flyer posted on Facebook, and if that subject applies to you or your family or you have interest in those, we encourage you to participate. And again, if you do not feel like you are getting the assistance you need, call my hotline at 253-967-3831. Leave your name and number, and we will get back with you. Okay, time for questions. Okay, first question is from Joel. How long would units be quarantined if they had to be? The answer is 14 days. 14 days, and that's the same across DOD. Next question is from Marty, and I'll ask our Madigan commander to come up and introduce himself. Can MEMC post pharmacy wait times online?
Marty is the name, sir? Yeah. Thank you, sir. Marty, thank you for the question. They could, but they are fluctuating and fluid. And so I would tell you that in talking to the staff the other day, they recommended earlier in the week is better. Monday through Wednesday is typically a better time to show up. But I will tell you, based on the efficiencies that have been created by Team Madigan, the pharmacy wait time for the drive-through is oftentimes less than it is if you had recently come into the outpatient pharmacy in the actual lobby itself. It is absolutely amazing. If you try to just kind of avoid the lunch hour time, pretty much any other time is a relatively good time. You're looking at 30, 40 minutes, usually on the high end, for waiting for your prescriptions. That is an unbelievable record, and it's a testament to Team Madigan and our pharmacy.
Okay, and I will tell you, I have been over there and seen the lines have been very short. So yes, I appreciate what you guys are doing over there with that. Okay, next question is from Janine. Will essential personnel still use or lose leave? Okay, that's probably something we need to ask up. I will tell you right now that I am 99% sure that the answer to that question is no. But we will ask. Those are some of the things that we are sending up. And I will also say that we are talking about when this stay-at-home, stay-healthy is lifted and we kind of get our schedule back up. There were block leave times scheduled for this summer, and we'll look to institute those block leave times as well. Okay, next question is from Missy. Is Madigan hiring civilian medical personnel? From Missy.
Missy, thank you for the question. Madigan is still hiring medical personnel. It is a little bit slower than it's been because a lot of our personnel actually come from out of state and all over the country and overseas for that matter. There is still a trickling in of folks, and there are still USA jobs online for you to apply for, and I recommend if those are jobs you're interested in, you meet the qualifications, please by all means apply for them.
Okay, related to that, do you want to mention anything Colonel Duncan, our Garrison Commander, mentioned on hiring?
Absolutely, thank you, sir. Yeah, same goes for all the Garrison jobs. Please apply at usajobs.com, as Colonel Bunt just mentioned. We are still bringing people in. We have the restrictions of they got to be within 50 miles radius for us to bring them on board. But if you know people who live in the local area, then we are absolutely bringing them on board. Thank you.
Okay, and I know we can do that. We've had that discussion with that in line with the COVID mitigation measures. Okay, next question's from Christian. Are deploying units being extended, and for how long? So the answer to that, Christian, is we do expect for those units that right now that are deployed that they will. Some of them potentially could be extended, and depending again on when the units are. I don't know what specific unit you're talking about. We got quite a few units that are deployed. We do expect to get information in the next couple of weeks back on that. The minute we have anything particular to any deployment, First, we will make sure that you hear it not in this, but that the unit can send it out and we can contact families directly. But then we will also put it out in here publicly so everybody knows.
All right, I have a question that asked, will soldiers lose their promotable status if their weapons qualification expires? And again, the answer is no. Here's what I will tell you though. If you're in a promotable status, first thing you need to do is talk to your chain of command and your S1. There are some specific things like, was your weapons qualification expired prior to COVID or not? And if the answer is it was not, then it is extended up to a year, just like your APFT. And again, I would encourage you to see your chain of command and your unit S1.
Thanks, Sergeant Major. Okay, next question's from Terry. Why are the prices seemingly going up at the commissary? Colonel Duncan, can you?
Thank you, Terry, for the question. There are some prices that are going up at the commissary. We've been monitoring this closely. I can guarantee you there is zero price gouging going on at the commissary, but because the prices are legally mandated, congressional law, United States law, that they are a price, whatever they pay from the supplier, plus a small percentage in order to just keep the commissary running. So, but the prices are going up. Specifically, we're seeing prices go up pretty high on eggs, beef, and hamburger. There are some other prices that are going up just a little bit, and we might see, as the national shortages continue in some of these areas, we might see prices go up a little bit in milk, chicken, things like that. Right now, they're only going up very, very slightly, but yes, we are seeing some prices go up, and this is absolutely a national issue, really an international issue, as transportation costs go up and as suppliers decrease.
Thanks, Guy. Next question's from Liam. I live in the barracks. Do I have to ask permission to leave my company area for essentials? The answer to that is no. Of course not. You do not have to ask permission to leave your company area for essentials.
All right, next question is, the CDC recommends wearing cloth face coverings. Are there any restrictions on style, color, etc.? Is there a preferred template? Here's what I'll tell you, that if you have the masks or the face coverings that are issued through the medical provider, those are authorized. If you are looking for a template, what you can do is look on the JBLM Facebook page, which clearly outlines, one, the DOD and the Department of the Army standard for not only the type of mask, but the colors that you can wear. And it also gives some examples for those folks who are crafty or handy that would like to make their own.
Okay. Next question's from Vincent. How can I separate and claim VA benefits when providers keep canceling my non-essential procedures? You want to take that one, or Dr. Leonard?
Okay, Vincent, thank you for the question. A lot of the routine and non-essential procedures, as you know, have been postponed and in some cases done virtually. A lot of these things can be done virtually. The VA is in exactly the same position we are in this respect. We're still doing the MEB components of the physical assessments, and some of these things are still going to have to be followed up on. So I think we have Dr. Leonard who's going to give a couple more comments on that.
So thank you, Vincent. I have some actual very specific guidelines that I got from the MEB today that I wanted to read. The MEB continues to process MEBs using telephonic interviews and email communications. In-person visits are temporarily on hold. Pueblo and provider staffing at the MEB building have been reduced to minimize the risk of exposure to soldiers and staff members. New MEB referrals are temporarily on hold until the MEB receives confirmation that the VA is able to continue to process claims and examine soldiers. Soldiers or providers with questions may contact their Pueblo if they have been assigned a Pueblo officer or the MEB operations. And I will actually go back and post this email address because it's very, very long, and if I read it, it would just get lost in the translation. So I'll go back into the Facebook comments and post that email address. Thank you.
Thanks, Dr. Leonard. Okay, anonymous question here. Washington DOL is closed and my car tabs are expired. Will I get cited coming through the gate? You want to take that, you or Omar? Yeah.
Thanks. What was the name on that one, sir?
There is no name.
Oh, okay.
Just have to answer
So,
the question, yeah.
Yeah. Thank you for the question. We are not citing, Washington has extended their tags by 90 days. As of April 3rd, Washington State extended their driver's license and tags on their cars for 90 days. And we are abiding by that, of course, since most of the people that come in the gates are from Washington State. So we will, we might remind you that you need to go get them, and please do go renew them. Most of this can be done online, so please do renew them if you have the opportunity, if it can be done online, but we're not going to stop you at the gates.
Yeah,
Yeah,
so,
we will do the same for other states as well. If it's expired, we will ask you if you're in the process of renewing it, and we'll let you on.
yeah. And I'll give, this is some dad advice here I give to my kids, is that most of this can be done online. And renew your license plates. I know that's how I've renewed my license plates. So you go online, and they're still going to backdate it anyway to whenever your plate's expired. So the sooner you can get online and get that taken care of, I think it will be better. But most states have, if you go online too, my other suggestion would be if you can go online and probably print out whatever your state is and have that with you.
Absolutely.
If you're worried about that coming through the gate.
Paper copy until they come in the mail?
Yeah.
Sure.
Okay? Okay, Sky, this one is for you. Katie, it's from Katie. Are child care workers being provided masks?
Thanks, Katie. Yes. Yes, we are providing masks to the child care workers. We're in the process of procuring those right now. So right now you'll see them at the people who are doing the screening, and then it's optional for the folks that are doing direct care right now to wear them, and as we finish procuring those, but you will see those at the front when you do the initial screening. Thank you.
Thanks, Guy. Okay, next question is from Karen. What about pathways? Will there be a new date, or is it permanently canceled? So we are actually going through some planning on that right now. I do not see anything moving towards pathways or for exercises in the Pacific over the next 45 or 60 days, even move in that direction. And what we are doing is taking a look at when, because they're dealing with COVID out in the Pacific as well, is when eventually we would continue to start exercises and other activities will happen in the Pacific. So it's not permanently canceled, but we will go through, there's two aspects of this, when those other countries will be ready, and then also when we'll be ready, and at a training level that we want to go ahead and execute that. So those are the two factors that we're looking at for pathways. Next question is from Leanna. Since schools are closed for the rest of the year, will school-age services reopen after May 4th?
Thank you, Leanna. So we have we're looking right now at how to reopen the school-age services and the child development centers, as well as school-age sports, et cetera. We're looking at how to reopen that in line with two guidelines, Washington State guidelines, make sure, of course, that they've lifted their stay-at-home, stay healthy, and then as the Corps and the wing begin to bring their personnel back on base, and we see the need to reinvigorate those processes as we go back to whatever the normal is. Once we get a clear date on what the new normal date is where we can return, then we are planning for how to do that right now in an organized fashion. So once we get that official date, I don't know that it'll be exactly May 4th. Once we get that official date that we're going back, then yes, we will ramp up all services across CDC, CYS, sports, et cetera.
Thanks, Guy. So Leanna, I want to talk about that a little bit, because one of the things that we are looking at with our entire staff and with the medical professionals is, just as if you've been with us here for the last 40 days and we've been enacting different HPCon measures slowly over time, it's been at the advice of our medical professionals and in how we're doing things to stop certain activities or shut things down, and also in line with Washington State. We are actually going through that same process right now, where we are looking at criteria that they would come back and tell us when we can do certain things. When do we no longer need to have MPs in front of the commissary or the PX, or to limit restrictions? But again, all that is going to be based on the situation surrounding COVID and the threat that it presents to our community. So we'll be very deliberate with that, and we'll be in line with the Washington State and their Department of Health professionals as well. And it's going to be very hard to put a date on it. So we will, and that's why I say every week we are going to be here. We will explain to you what we know and kind of what our planning factors are, and that's what we're going through right now, and we will kind of tell you. So what I do look forward to doing in the next week or two is kind of giving you an idea how we see this, how we would envision this all unfolding back in the opposite direction. But it's basically just going to be a gradual loosening of some of the restrictions that we have in place. Okay, next question is from Shelby. Why aren't those paying rent in 2 places getting PCS exceptions? So those are exceptions to policy. So we've recently gotten some new guidance from Department of Army to resubmit denied exceptions to policies. We are doing that. Again, this is for everybody who's in PCS limbo, and I know Sergeant Major and General Brunson and Sergeant Major Bulmer were all in with our G1 and chaired a session on that earlier today. We know you out there by name, so I would ask that if you're, talk to your chain of command, if your exception to policy you don't feel like has had action on it, you again are welcome to call 253-967-3831, but also talk to your chain of command and we'll make sure that that gets taken care of. I can't promise you it will be approved. It's not approved at my level or the Force Comm commander's level. It's approved in DC. But we can definitely let you know where that's at. Okay, next question is from Cass. Can we stop allowing people to play sports at Cowan Stadium? Okay, that is yes. The answer to that is yes, we can stop that, and we will. And we'll have the field officer of the day and anybody else that needs to go over and make sure that is not taking place at Cowan Stadium. Can I get Dr. Leonard to come up here and just talk general? Let's just talk about sporting activities and why it is, because this is hard. I grew up, I'm a sports junkie. Why don't we want to do these things with sports?
So non-contact, the sports where you're able to keep a significant distance from somebody else. I think Sergeant Major used the idea of somebody throwing football back and forth. Those things
Frisbee,
are fine.
yeah.
The things that we're trying to avoid are people getting in close contact, just like we do with all of the other activities that people are doing. So most sports where you can do them on your own, running, for example, a great sport to do on your own. But those contact sports, those sports where 2 people get close to each other and they're potentially breathing out virus, those are the things we want to avoid. And then when you think about it, when you see 2 people who potentially don't live together, infecting each other in one way or the other, they bring it back to their area, they bring it back to their family. And so this can spread very, very quickly, and it does spread very, very quickly through these kinds of means. So having contact or having group or having organized sports where people are close together is pretty, we do recommend you don't do those things.
Okay, and I want to tell everybody again, this gets to tie into the previous question, when is all this over? The better we are, and I think that's a proven fact, isn't that right, Dr. Leonard? The proven fact that the better we are at the physical distancing and all the hygiene measures, the better we do with that, the quicker that we will get all of this under control. So it's just a personal responsibility from everybody. I'm asking everybody out there to abide by these
Absolutely.
rules
So
for the benefit of our community.
Perfectly summarized. The better we are at following the measures that keep people from getting sick, the shorter this whole thing will go.
Okay,
Thank you, sir.
thanks. So similar question from John, is social distancing being legally enforced on post? Yes, as a general order, we can legally enforce this on post. Typically, what have I seen, or the Sergeant Major have seen, we see some folks that maybe are a little too close that are talking. The first thing we're going to do is tell people to spread out and do those things. And so I encourage everybody to help enforce. It's our standard. It's our community standard that we want to make sure that we're enforcing here on JBLM. Next question's from Tiffany. Will medical retirements be longer due to this? Is the VA up and running? So I don't know who wants to answer that. I think everything's going to be longer.
Who's the question from, sir?
Tiffany?
Tiffany, thank you for the question. This could be a protracted time, depending on what the particular elements are to your actual medical retirement. If there require any surgeries that must take place before, those would consider in a different category. If they are not, and they're oftentimes elective or things that we might believe would improve a person's position, those can be postponed and done by the VA at a later date. We'll go back and try to find out some more fidelity on this question from the VA themselves as well, because they are in the same position we are exactly, and we are, just like with anything else, having some extensions in other areas where you didn't expect them, PCS and otherwise, and I think this would probably more than likely fall into the same category, but we'll circle back and put it up on our Facebook as well, so we'll have the question out there.
And I know, thanks, Tom. And I know, again, a good planning factor is that everything's going to take probably a little bit longer.
We should plan on that.
But I would also ask everybody out there is if there are things that we have talked about being open or expected to be open, or we have numbers for it, then you owe it to keep us honest on if you're calling and you're not getting something, then tell us what that is, and we'll make sure that we follow up, or there's not a broken connection somewhere with that.
Yes, sir. Can do.
And I'd like to follow up on that as well. For anybody that's retiring right now, as long as you don't have an MRD, you have the option of requesting to extend your retirement up until November of 2020. And so what I would also say is if you're not comfortable with the process right now while you're trying to retire with the VA, then go ahead and submit that retirement. It's your right to get to go through the retirement in the VA process. But I will also tell you this, that the VA processes that can be done after you retire, getting a VA rating is not the same as retiring. But if you're not comfortable with leaving the Army without your rating and you would like to submit that extension, go ahead and do it. And we'd be happy to take care of you on the backside.
Okay, question from Adriana. Will the CDC go back to normal operations after May 11th? The honest answer to that is we don't know. It could be, again, if we are able to resume normal operations. I don't see us going normal. I think that we'll start ramping things back up. Anything you want to add to that?
No, it's the same as we just.
Yeah. Okay, from Summer. Summer says, I have seen several news stories regarding testing to affirm that you had the virus. Will MEMC be participating in this blood testing to see if you've already had the virus or antibodies? No. I hadn't heard that.
Yes. Thank you, Summer, for the question. And I believe you're referring to the serologic testing for antibodies to COVID-19. Recently, in the last week, there was an FDA-approved, also got that emergency use authorization, just like all of the genetic molecular tests that we're currently using for determining whether or not you had been infected. This test is really good for those people who have already recovered from their illness or are well along the way. So it's really not useful for us from an epidemiologic standpoint at this time because folks will already have been ill. It's good for getting an idea of how widespread the disease has been. So we'll probably be looking for this on the other side of this crisis at this point.
So the next question is, if a soldier was or is currently flagged as an APFT failure, can he still take one to remove the flag? So the short answer is no. Right now, because of social distancing, we are not taking the APFTs. The Army has extended your APFT current score, just like the promotable status, for up to a year. So if you were flagged prior to this, that flag stands. Once we get out of COVID and you have an opportunity to take an APFT, I would encourage you to take it and pass.
Okay, lots of opportunity to do some extra PT here as well. Okay, this next question's from Onaipa. If your unit keeps asking you to come in and you are not essential, how do we address that issue? Okay, I guess I would say that I would address that issue with your chain of command. I do know that we probably have 35 to 40% based on traffic that's coming in. We have and that's in some units, like I said, the hospital a lot of our MPs and other folks are working at full up units. And so I know that our mission essential numbers are way, way down across all of Joint Base Lewis McChord. So what I would ask is, I know I'm expecting, and again, chain of commands briefed this up to me, and I could go down the myriad of things. Maybe it's a mechanic doing something. Mission essential does change on a day, can change on a day-to-day basis. I've asked them to brief me out. So they've talked to the Sergeant Major and I a week out on mission essential, so it's going to change. But if you feel like, one is, I don't expect people to be coming in just for a formation or checks or anything like that. And I've been very clear about that we have people in and only in when they're mission essential. But if you feel like there's a real issue with that, again, you can call my hotline and we'll be happy to address that issue. Okay, next question is from Janet. Can you address the usage of playgrounds? Okay, we've had a lot of discussion about playgrounds. And so in general, I'm gonna ask first to come, I'm gonna ask Dr. Leonard or Dr. Feistel, somebody to come up, either one, to talk about playgrounds.
Sure. Thank you, sir. So it goes back to what we were talking about with organized sports, and it's the same thing. The one thing that we do know about this disease is that when kids get it, they tend to be more mildly symptomatic or even asymptomatic. So the issue here is kids who may be mildly symptomatic or even asymptomatic, most kids have runny noses this time of year anyway. We may not know whether or not they're ill. So they go to the playground and they play with other kids. And that's the risk. It's not the equipment as much, because the equipment, just sitting out in the sun, after a while, the risk gets fairly low, and especially if it's being underutilized. It's the risk of having those kids close to each other. And again, those kids bring it back to their families, and those families have other contacts potentially outside of the family, and that's how these things spread. So what we're asking for really is that personal responsibility, as General George was emphasizing, and that's when you're watching your kids or you're bringing them to places like this, you kind of make sure that you police them up and make sure they're not interacting with the other kids or the other families as much.
Okay. Call out to parents. Okay. From Ashley, when the travel ban is lifted, we'll be able to take leave in conjunction with PCS travel. I think, I don't see why not. I don't know your specific case, but typically you are authorized leave in conjunction with your travel. I do, like I said up front, I do expect some things to adjust as far as with report dates and things like that because of what the travel ban or the PCS ban that we've been under, but I would see no reason why you couldn't take leave in conjunction with your PCS travel. Next question's from Courtney. How do those soldiers who need to get on MedPros and other sites to complete things get on without a government computer? That's a really good question. It's like a pet peeve of mine here on the CAC stuff. Anybody want to answer that question? Huh?
Yeah. Yeah, exactly. So I think I'll take a swipe at this one, and we can clarify anything that I'm not able to answer clearly. DMDC is username and password accessible, and then if you need a CAC card to get onto it and you don't have a government computer, then if you have a CAC reader at home, that just any personal computer with a CAC card reader. If you don't have a CAC card reader at home, then yeah, you'll probably have to get one from your unit to be able to get on to the computer. But it doesn't. Bottom line, it doesn't require a government computer. It requires either a username and password or a CAC card with a CAC reader to get onto those MedPros sites, which is on the Army.mil or the MedPros sites.
So I got my question is, why would who needs to get on a MedPros except for a provider or somebody in that?
I think
I'm expecting all those folks to be at work.
Right.
All those medical folks.
Right. Yeah. Yes, sir.
PHA?
Yeah.
Okay.
It's
So
the
it's AKO?
But that's not MedPros, that's logging on to the AKO.
That's logging on to your
Use GS
AKO.
login.
correct.
Okay.
I'm thinking that's where the question is coming from, is that part one of the PHA, which you do have to log on and do. If it's
Okay.
a MedPros specific provider
Okay.
question, I guess that's.
Yeah,
gotta be on the
MedPros is provider, but if it's PHA,
Yeah.
then it's AKO.
When you
Should be
go
able to
into
get an
AKO, you go into your medical page and you go down to PHA.
Yeah,
Red tab.
Yes, sir, and you can
Okay.
use your GS login to get into AKO.
okay. Next question's from Amy. Are face masks required to enter the commissary? I think right now, no. Again, we would ask everybody, you are, of course, welcome to wear a face mask. Anybody who wants to go in there. I have seen folks that are coming in that want to wear a mask. But right now, we just ask everybody to maintain their physical distance. I think that's what's most important at the commissary.
I'd like to do a follow-up on the face mask. Earlier, it was asked about face masks and color and style. But one of the things I would like to tell all the soldiers out there, right now, I said earlier, we're issuing our the surgical type masks and N95s out to our DES and our medical personnel. All soldiers are issued a neck gaiter, either black or brown, and you are encouraged to dig that out of your kit bag and use that because it is an approved type of face type mask or shield, and that will protect you. And even on our gates, our ACPs, that's what our soldiers that are pulling that duty, who are checking your ID cards, are going to start wearing tomorrow, just because we just do not have the sheer numbers of the medical type masks. So again, I encourage you to pull out your neck gaiter and use that. And again, anybody can wear a mask. If you feel that you can't, maintain the 6 foot of separation, or you feel that you may be sick or someone else is, and you didn't stay at home like you should have, go ahead and wear that mask or neck gaiter to protect yourself and others. Okay, so here's another question about face coverings or face masks. It says, well, I have to remove my face covering to enter a gate. Okay, so if you read the DOD directive that the SecDef wrote, he specifically stated situations where a face covering or face mask is required to be removed. So if you come through the gate and you're wearing one, and the DES or the gate guard says, hey, can you pull down your mask or your protective covering so I can confirm that you are the person in this ID card, you are absolutely required to do that to enter this installation.
Okay, next question's from Melanie. Is admin pay going to stop for any reason? I'm not sure. Sky, you got that?
Yeah, I think we're talking, thanks Melanie for the question. I think we're probably talking about admin leave as the umbrella covering. So we've talked in the town halls previously about there's sort of 3 areas that civilians are covered under: admin leave, broad category, telework, just working from home, or sick leave if you actually are sick. And so to answer your question, no, there is no intent right now to stop any admin leave as the broad covering for if you're not at work during these COVID times. Thanks, Melanie.
Next question's from Zoe. Can I still get emergency dental on post if required? Emergency dental. I think the answer to that is yes, it is available.
Who's asked the question? Zoe, thanks for the question. Yes, you can get emergency dental. I would definitely contact them to kind of give them a description of what it is you need, because there's actually several things they can do. For a lot of these procedures, they require PPE and things like that, so don't let that alarm you. But if you have an emergency, by all means, contact your dental clinic immediately.
Hand those straight over to you.
Take care of that. From Linda, is the lab open at Madigan? Not inside the main lab, no, at this time. It can be used from other clinics that are open within Madigan proper, however, because we have lab personnel back there. There are just only a few of them in there based on the social distancing and the safety factors, and they can run the labs back, so there should be no problem with that should you need one from your provider or order it on part of your visit. From Laura, can I get an OBGYN appointment? This all depends on what type of appointment we're talking about, and yes, you can. It'll just more than likely be virtual, or a telemed, a TCON on a phone. So it's the easiest thing is to contact the clinic directly or call the PSMAC line. It's the the Puget Sound patient appointment line. And that number is 1-800-408-4506, and ask for one of those appointments in OBGYN where they'll do virtual. They have several of them already loaded up in there, and that's at least a great way to get started and answer your questions, because you probably have more than just that one question.
Thanks, Tom. Yep. Okay, next question's from Pat. Is JBLM going to ban retirees from the base? Said no plans right now to ban retirees from the base. You're a big part of our community, and there's no plans to do that. Keep them coming. Okay, next question's from Amanda. For those who purchased items at the Northwest Adventure Center, how can we pick them up?
Thank you for the question, Amanda. You absolutely can pick them up. And I'm going to do a shameless plug really quick from the JBLM 360 app, and I'm going to look up the phone number for the Northwest Adventure Center. 967-7744. There is an employee there. There is somebody at the Northwest Adventure Center, so please give them a call, 967-7744, and you absolutely can pick up your stuff that you purchased there. Thank you, Amanda.
Okay, next question is from Ashley. Can dependents proceed to our next duty station? I'm a DA civilian and my husband is a soldier. Yes, and we're not restricting what spouses and the rest of your family will do. I know that there is a Washington state order that actually asks us to stay. There is a order from the president that asked everybody to not travel and to stay. I can tell you that if you do leave or decide to go on ahead, you will not get any travel pay. None of that stuff will happen up front because none of that's being processed for moves. Okay, next question's from Daniel. What's being done to make sure the federal contractors on post are following all the safety procedures set in place? We've got a lot of watchdogs. This one. A lot of watchdogs out there.
We do. Thanks, Daniel. So, Daniel, we rely on each individual contracting officer's representative, each COR, to verify that the employees under that contract are using the proper procedures. And if you're a contractor listening in, please, Washington state law does apply, OSHA regulations apply, COVID response mechanisms apply. So I would ask you all to follow the same regulations that we've been talking about here to ensure that we get over this hump and that we don't go up on a second curve after this. If we all work through together on this, we can do it.
Thanks, Kai. Next question's from Angie. How will the backlog of PCS moves be handled when the travel restrictions are lifted? So that, as I stated up front, this is going to be we're going to have to go through a very deliberate process. There's only a certain number of movers, and as everyone knows in the military, the peak moving months that are already scheduled, I think, are May, June, July, August, and September, and now we're stacking on, some February, March, and April moves on that. So this is something that we are talking about with Forces Command, Headquarters, Department of the Army to determine, because there's going to have to be some prioritization. And I don't know if it'll be exactly based on dates, but I do expect that there'll be other things that will go into play as far as units that are getting ready to deploy and prep and do different things. So there's going to be a lot of variables in that. And again, as we start to come back in here over the coming weeks, we will make sure that we tell you what we know and how we're planning and looking at this. But I would expect it to be backlogged, like I said, for a couple weeks to maybe a couple of months. Okay, next question's from Grant. Are people on TDY going to all get ETPs, exception to policies, to return home? In most cases, yes. I do think that there'll be exception to policy to return folks home. Next question, Tom, come on up here for this one from Brandy. Can we continue physical therapy appointments?
Okay, Brandy, thank you for the question. Not in person. They are not considered critical. However, I can tell you that if you do go on, whether it's the MHS Genesis portal or call them, I recommend the portal, especially if you're enrolled to it, right? Because they can send you all sorts of literature and tell you ways you can do that body manipulation depending on what sort of issue you have. I know this for a fact because they send the kind of stuff to me, and sometimes I do stuff that's probably not right for a guy my age, but these physical therapists are very good about it, and they're very good about getting back with you within 24 to 48 hours. So that's the way we're doing these right now. And then also, Laura, you had a question on can we still schedule appointments at Madigan? You can schedule appointments for virtual type of appointments, and if you have any kind of acute, severe type of urgent kind of situation, you can often do those in person too. But we always ask folks to, if you can contact us ahead of time, talk to us a little bit about what your issues you're having, or you could talk to the nurse advice line. It might have to save you from even having to come in for an appointment at all in the first place, and keep you safer that way.
Thanks, Tom.
Yes, sir.
So the next question I have is, it says, why are soldiers outside the commissary and at the gate not provided face shields? So I'm assuming this is separate than a face mask, but there's no requirement right now for a face shield, like a full shield. But the DES personnel and the medical personnel are provided the face masks, and soldiers are wearing them, as well as the gaiters that I talked about earlier. But right now, there is no medical recommendation for soldiers at the gates or at the commissary to be provided a face shield.
Okay, next question's from Gary. How can I get daily updates on post-COVID related changes? So the same, every day we are still posting the blue hash, and it is our plan, and every day when we post the COVID blue hash that's out there, as we start to change again, so maybe adding things back, just like we've highlighted the changes on a daily basis, we will do the same thing in reverse. So we will have the blue hash will go out, and eventually we won't be a blue hash, but until then, as we change the measures, that's exactly what we'll send out, so we'll use the same thing. It's posted, it's tagged at the top of Facebook right here, and it's also on the website, and we do send that out daily. Okay, next question's from Xavier. Will face masks be provided for essential employees? Colonel Duncan.
Thanks, Xavier. Yes. Yes, we are providing face masks for essential employees, and I think, let me answer mostly for civilians. Yes, we are. We're in the procurement process right now. I mean, this guidance just came out Friday, so we are still procuring them, so you're not going to see them immediately, but we are procuring those for folks overall. If it's for service members, I'll just reemphasize what the CSM mentioned earlier, which is to use the CIF or initial issue gaiters as because what we're talking about here is cloth face coverings to prevent the spread through coughing and things like that. So you can also use your initial issue items for that.
That also came, in there a CDC recommendation that's also just out on the cloth coverings, is that
Right,
correct?
exactly, yes,
Yeah.
sir. That's what a lot of this is based on, is exactly what we're following, as we always have in the whole of government approach, following CDC guidance, and it specifically talks about cloth face coverings to prevent you from coughing on somebody else. They know it's not to filter the air coming in, it's to prevent you from coughing on other people, and that's, again, if you cannot maintain the 6 feet of separation. If you feel like you need to wear one, by all means. If it's in uniform, it's got to match the uniform or be appropriate, and if it's a civilian, then we'll provide those as we get those in stock.
Okay, this question's from Brittany. Are phones being manned at Okubo Clinic? My husband had an appointment that wasn't canceled, but he could not get a hold of anyone. I don't know if I got that clinic right.
Hey, thank you, Brittany, for the question. Are phones being manned at a Kubo clinic? My husband had an appointment that wasn't canceled, but he could not get a hold of anyone. I think what we can do in that case, I'll swing around with you. These are one of those that might get into some kind of personal medical information. Probably best to kind of link you in. So I'm going to give you my patient advocate number, 253-968-1145, option 4, and relay that. There are phones being manned, but it depends on which lines what we're talking about here. You could always call the patient appointment line as well and ask to be linked in that way, or the what we call the dish for the primary care clinics out there across the footprint. We've done some changes around for where some of those providers are located. That's why I'm giving you these directions to call this number to try to get you in the right bucket.
All right, the next question. Can I stay longer after my PCS date? The delay has pushed me too late into my pregnancy to safely travel. What should I do? Absolutely, one, I would tell you to work with your chain of command and your PCM because that could put you into an at-risk or high-risk category for travel. And absolutely nobody at this table wants you to be traveling, probably in your third, fourth trimester. So what we recommend is talking to your doctor first, your chain of command. You relay that to your branch, and they will extend your assignment instructions. If not, you can also request through a 4187 to a delay for an additional year here at JBLM.
Yeah, and we've got a lot of instructions, right, Sergeant Major, as far as getting, there should be no challenge here getting
Yes, sir.
for one additional year.
Yep.
Okay, this question is from Carrie. Who is ensuring that buildings are being sanitized and cleaned properly after there have been COVID-positive soldiers, workers in the building? I know Colonel Duncan's got a great plan
Take
for
that
that.
one. Thank
Yep.
you for the question, Carrie. So this applies to our team clean that we've referenced a couple times. Bottom line, through the preventive medicine folks give us advice, the preventive medicine doctors give us advice, and they in fact have accompanied on these teams as we go out, and it's a dedicated team, one from the Air Force, one from the Army, that go out and clean any facility that has had a COVID positive person that has gone in. And that we identify what facilities they've gone in through what's called the contact trace process. So if they've gone into, say, a restaurant, we go in and clean that restaurant, everything in it, the chairs, the counters, anything that they could have possibly touched with that team. And they use CDC-approved sanitizing solutions to do that process.
Okay, next question is, what is the purpose of the face mask? What is it preventing? So I know we've had some Dr. Leonard or somebody come up and doctor-approved answer.
Thank you, sir. So we've kind of been talking around this a little bit, and I just want to make it very, very clear that there's a difference between the face coverings and the face protection versus the face mask. Face masks, face shields, gloves, gowns, those are all considered PPE, or the personal protective equipment that the medical professionals use whenever they're interacting with somebody who may be a potential risk. These face coverings that we're talking about are actually preventing the wearer from doing a couple of things. The big thing being spreading that to other folks. We know that this virus is spread through what we call fomites, that is like dust resting on a surface. You touch that, and then you touch your mucous membranes of your face, your eyes, the virus gets introduced. The virus has one purpose in life, and that's to make more copies of itself. It gets into your nasal mucosa or your pharynx, and it makes more copies of itself. What these masks do is that they prevent that respiratory droplet from escaping. It acts almost like a sponge, which is why we encourage you to wash them on a daily basis. But whenever you go outside and it's a particularly humid day or it's a cold day, you see your breath. That's respiratory droplets. That's actually condensate of respiratory droplets. Those can spread, and the virus spreads in those. So the masks protect you in a way that they're protecting everybody. So indirectly, you get a benefit from wearing these face coverings, because what happens is it decreases the amount of transmission of the virus in the community and gives the chances of you getting it a lot lower, makes the chances lower. So hopefully I answered that one
Yeah,
definitively.
that was really good. Can you do a little video for us and put that on the, just to talk about face masks and PPE? We've had enough, and just this whole thing, and
Yes, sir. I'd love to.
the good doctor talk right there, that'd be great. Okay. All right, next question, and Tom, Team Madigan's gonna have to come here on this one, is from Chris. Are medical specialists such as developmental pediatrician or physical medicine still making in-person appointments? I think I know the answer to that, but.
Chris, thank you for the question. They are not making in-person appointments, but I can tell you, speaking of videos, just made a video yesterday with one of the heads basically of our CARES program right there on the Madigan campus. And they are doing a lot of virtual telemedicine, TCON type of consulting and appointments. They're talking to a lot of kids that way, and they're talking to a lot of parents that way, and they're really talking about a lot of routine things as well that we can do with our kids during this time where, they're kind of spending a lot more time together, if you will, and it's been very beneficial. I would ask that a lot of these questions are like this. please go on Madigan's website as well. It is linked through JBLM as well if you want to hit that. And watch some of those videos on there. They're subject-based on there. We've got some of those pieces on there. We've talked a lot about PPE, and we do them twice a week, and we do 4 videos every shoot. So this is a great opportunity for you to get educated on that and get some of these questions answered. Thank you, sir. And from James, thank you for the question. Are housing contractors eligible to be tested if they are showing symptoms? I think if they're working on this base and they're part of a contract for us, yes, they are eligible to get tested. We're not doing those kind of checks here. But the difficult thing is for medical record follow-up, they will not be in our system. So we'll have to have a different way of capturing that piece of information. But obviously, if they become symptomatic here and it becomes based on something they're doing on post, that is probably something we need to follow up with you on health-wise.
Thanks, Tom. Okay, I think we had one of these questions last week, but probably worth hitting again. Colonel Duncan is from Kurt. I live in my RV full-time and currently in the campground. Will I be allowed to shelter in place until the travel ban is lifted?
Thank you, Kurt. The answer is most likely. So please contact the Outdoor Rec Center, the one you made your reservations through. And we've already extended several people. I would just ask that you contact them directly, and we'll handle this on a case-by-case basis. So we are following the intent of the law here, which is that folks are staying at home. If this is your home, then that probably is something we'll definitely look at. If somebody's here on vacation, I don't know, we'll have to have a discussion. If it's somebody who is here on a PCS move and they're even PCSing in or out, then that kind of essentially it is your home. So I think that'll be an easy extension. Bottom line is we will work with you. Please give us a call at the front desk and we'll talk. Thank you.
Thanks, Guy. Next question's from Jenna Lee. Is Madigan working on possible COVID vaccines? So I know that's happening out at Fort Detrick in the Army Research Labs.
Jenna Lee, thank you for the question. I would tell you that in a way, we are. We are working mostly, though, in this capacity on research, whether it's prophylactics type of therapies, eventually vaccines and that sort of thing. There's a lot of folks engaged in this, and I can tell you Madigan is one of those that is working on some of those potential therapies right now, and also some previous, I will tell you some shameless plug for some previous Madigan professionals, of which there are quite a few, are now working at Fort Detrick. My chief medical officer, who the good Dr. Leonard here replaces, actually the head on one of these studies, who's working on it right now, and I can tell you if he's on the job, we are very good. We're in very good hands.
Yeah, and I know it's, and General McConville is out here, it's a full effort right now out at Fort Detrick and
Yes, sir.
across Army medicine to figure that out. Okay.
Sir.
Okay. Next question from Nazoni. Can the Education Center still provide CLEP testing virtually?
That was Tony, you
Good
said?
question, Nazoni.
Oh, I'm sorry about that. Nazoni, thank you for the question. I need to get back with you on that specific capability. We have a lot of virtual capabilities. Let me make sure I don't answer you wrong, though. Can you please contact the Stone Education Center? We do have somebody there, and I will make sure we get you an answer. In fact, I'll also make sure we follow up in the Facebook feed to specifically answer that question. It's a good question. Thank you.
I think a lot of testings can be done or done on the website. The problem is, how do they know that you're the only one, you know, somewhere? I know that you would never have anybody help you with this, but that's usually the challenge that we have.
All right, I think we're on one of the last questions. So this one comes from Steve. It says, with the postponing of ALC or SLC for promotion, is the Army looking at primary, secondary zone for those competing or complete with required SSD or DLC or strictly primary zone? So one, the Army has gone, as you know, has gone to a talent management-based promotion system. Promotion points, obviously, for specialist to sergeant, sergeant to staff sergeant, and then from staff sergeant to sergeant first class and above are DA centralized, which do not have promotion points. But the Army is looking at how the promotion system for time of service, time and grade, and the rank system that currently exists, and is still promoting both the primary and the secondary zone as it stands.
Okay, well, that wraps things up for this evening. Thanks for joining us all this week. Again, we will be with you again next Tuesday. And we look for feedback on time. If this time is right, we have all the targeted Facebook mini town halls that are out there again that you can look at. And again, we invite you to post. I know everybody's going to be hunting the good stuff and staying active this week, and we ask that you post it to #JBLM Sound Living. Have a good evening and have a great week.